COVID has challenged healthcare services in many different ways. When the first pandemic wave reached us, we had to decide for safety reasons to forbid the admittance of patients' relatives to the emergency department. And this naturally has raised humanization concerns that we immediately tried to mitigate. Different tools were used with this objective. One of them was the development of a software system capable of sending notifications via short message services or the hospital app to our patients' relatives with some information, and the triggering events were, for example, the color of triage, the prescription of blood or imaging tests, and the final decision of discharging the patient or admitting the patient to the ward. This very simple system allowed us to maintain a close interaction with our patients' relatives, and definitely contributed to a positive experience that our patients and their families had during this very challenging period of our existence.
In the context of COVID-19 pandemic, several interventions were put in place in the intensive care medicine service in Centro Hospitalar Universitário São João. The first one, and the earlier one, was securing the supply chain, assessing existences and predicting demand. Diversifying the supplier ecosystem was put in place. The second one was drawing an adaptive pre-plan expansion of intensive care medicine service, going from the usual 70 beds to 116 beds. The third one was avoiding low and no value care by putting into the emergency department intensivist 24/7 for an early and expeditious and ethical assessment of all patients, trying to avoid care debt and deciding what would be the best level of care for each patient. The fourth one was implementing a communication plan, one in which we would listen and feel to all the intensive care staff and promote a lot of innovative ideas. The other one was taking care of the staff, mainly using the quadruple aim idea. Using occupational health and psychological and psychiatric support for everyone on need of that support. The sixth task was practicing patient-centeredness, namely putting in place a lot of telephone, web-based and video calls between the patient, the clinicians and their family to promote empathy and interaction between these three parts. And finally, promoting syndromic and geographic equity, mainly being able to receive patients from other areas of the country more affected and with less resources, and also after the first wave, changing the tune and changing the goal to be able to provide care to all COVID-19 and non-COVID-19 patients.
The COVID-19 pandemic posed a challenge to the health sector in several dimensions. Communication was one of the main areas, and where more errors were pointed out to institutions with political and public responsibilities. The Centro Hospitalar Universitário São João has been recognized on several occasions in the public and media scene for its communication. In addition to the classic principles of crisis communication, our communication strategy focused on proximity, availability and openness, common sense and a solid communication culture. The results of this strategic communication plan are the more than 14,000 mentions in use obtained during the first 12 months of the pandemic, which correspond to 70% for more than the second one. However, more important than the amount of news is its quality. Almost 100% of news is rated as positive. This hospital was perfectly aware from day one that the best strategy would be to stand side by side with the media and public opinion. Only in this way can we be a credible and trustworthy hospital.